Hi, my name is Jessiana Seville. I'm a registered dietitian and renal nutrition expert, and I'm coming in here today to talk about calcium and chronic kidney disease. Calcium is a very important mineral when it comes to kidney disease, and we see people's levels go too high and too low, both. And I want to explain a few reasons why they would go too high, what you would need to be watching out for, and clarify a few myths, as well as give you a few tips on how you can keep your bones strong and your calcium at the right level. So to start out, let's just back up a little bit on calcium. The reason calcium is so important with kidney disease is because your kidneys are involved with your bone mineral balance. They have some special hormones that they make that are really involved in this process. So when your kidneys decline, you can end up seeing that there's an imbalance in the minerals in your body, and some people can get some bone mineral disease because the bones are not getting the right nutrients in them to keep them strong and to keep them hard. On the other hand, we also see that within that same process, that in the blood, we'll see that calcium levels will go high, phosphorus levels can go high with chronic kidney disease as well. Now, not for everybody, but if you are having a problem with the high calcium levels, there's a few things that you can look at. So, high calcium levels. Common things that we see happen. Number one is sometimes people have uncontrolled parathyroid hormone levels that cause their calcium to go too high. We see this more often on dialysis versus earlier stage kidney disease, but it's still something to note. Number two, right? We see sometimes that people are accidentally taking too much vitamin D as a supplement and also causing their calcium to go high. Vitamin D helps you absorb calcium. It's one of its good roles in helping our bones stay strong. You need calcium and vitamin D and a couple other minerals. But sometimes people don't know it and they're taking too much vitamin D. I've seen a few times people have been prescribed a 50,000 IU vitamin D supplement once a month, and they don't realize it and are taking every week or every day, which will make your calcium levels go way, way high. So if your calcium levels are too high, check and see how much vitamin D you're taking, if that's something that you're taking. A third thing that can cause people's calcium levels to go high that I've seen, sometimes it can be literally from what we put in our mouth that has too much calcium. So people that are taking a lot of Tums to decrease heartburn, that can cause your calcium to go high. I've seen it go high for people drinking a lot of a fortified juice or fortified beverage that has calcium in it, or a fortified cereal. Those things that have a lot of added calcium to it can make your calcium levels go high. Now, I'm not saying that you can't drink those on occasion or eat a calcium fortified cereal. I am simply mentioning that if your calcium levels are high, that is something that you should look into what exactly you're putting in your mouth that might have a lot of calcium. So those are a couple things to note. Now, one of the questions we have on calcium supplements is, can I take them or should I take them? My doctor said that my bones are not very strong, so should I take calcium supplements? Or I've already been prescribed a calcium supplement, should I continue it? These are really good questions. A couple things about this. Number one is that calcium supplements have had a history in the last 10 to 15 years of quite a bit of controversy. On one side, they have said that calcium supplements, not calcium from food, but calcium supplements themselves, can cause blood vessels to calcify, that is causing some sort of vascular issues. On the other hand, we've also seen some studies that refute that and say calcium supplements are totally fine. Now, when you get into the weeds of this topic, there is more to calcium supplementation than just whether you take it or not. Number one is when you take it. Number two is what type you take. And number three is what the rest of the mineral content in your diet is like. So when you take it is important. If someone needs to take a calcium supplement and has been prescribed that by their doctor and the calcium levels are normal, then we usually like them to take it with their meals. Other minerals that can play into calcium getting into the right place into the bones or the right place in the cells is K2, magnesium, vitamin D. All of those are very important as well if you're going to be taking a calcium supplement. Now, specific amounts, I cannot recommend in a video because it is very individualized per the person. So if your doctor has recommended you take a calcium supplement, maybe for bone mineral density, I highly recommend that you get together with a dietitian, schedule a 90-minute appointment with someone on our team or with another dietitian, and what you're going to want to find out is what else you're going to need to keep your bones strong other than just calcium. The other piece of this with calcium supplements is we have this whole other subset of kidney disease, polycystic kidney disease, where calcium citrate has a particular role in binding oxalates. Calcium binds oxalates in the gut, And so it can be a very important piece if you're dealing with calcium oxalate stones, right? Calcium binds oxalate in the gut, so it doesn't get into the urine and doesn't create stones. Contrary to what some people think is like, if I eat less calcium, then I'll have less calcium oxalate stones. You actually want to get enough calcium to help bind the oxalates in the gut. And then when it gets to the urine, it won't create as many crystals. Same with polycystic kidney disease. We don't want to create microcrystals that are going to drive cyst growth. So calcium citrate can be important in both of those conditions. As a basic summary, and to give you a few actionable steps when it comes to calcium, is number one, if your calcium is high, look at what you're eating. Right? Look at all the things that are in your diet and see if you have anything that's fortified, any supplements, anything else, vitamins you might be taking, and see how much calcium they have in it. Number one. Number two, get your vitamin D levels checked. The normal goal is around 30 to 100 is what shows up on most lab reports. We aim for 50 to 100 as a therapeutic level to say that you have adequate vitamin D levels. We recommend that people always take, if they need to replenish their vitamin D levels, which is very common, they take a vitamin D3 supplement with K2. K2 helps the calcium get into the bones. So if your vitamin D levels are low, you definitely are going to want to replenish those, especially if you're taking a lot of supplemental calcium, because you want the calcium to get to the right place. If you're trying to increase calcium in your diet, maybe you're tracking your food and you notice that the one nutrient on a plant-based diet that's always low is your calcium. A couple things that you could add could be a really good organic tofu. Not all tofu is created equal, and it can get a bad rap in the kidney community, but we love it. I think there are some great benefits to it if you get a good organic one. We use some soybeans, we use collard greens, kidney beans, tahini. Tahini is sesame seed paste, a great source of calcium, and that's something that we'll also use with our patients to kind of bring the calcium up a little bit in the diet. If your calcium is really high, a couple things that you might notice is maybe some muscle weakness, pain in your abdomen, and maybe some bone pain. And if you're having symptoms like that and you haven't gotten your labs checked in a while, it'd be a good idea to go get them checked. So that is all for today on calcium. I hope that you found this helpful to know where we can get calcium in the food, what we should do about calcium supplements, and how to deal with a high calcium level. If you found this useful, please like it below. We love if people share this to their kidney groups that they're involved with, or on patient support groups, wherever you may find this information to be valuable. We appreciate so much when people share, and of course subscribe to the channel as well below so that you can continue to see some great cutting edge nutrition guidance for people with chronic kidney disease, so you can keep your kidneys as healthy as long as possible and preserve your kidney function. That's all for today. Bye-bye.